By the end of this video, you will learn a functional exercise to help you loosen up your stiff lower back. Hi guys, it's Chris with HealthyConsumer.com, and I have my lovely wife Danielle with me, and we're going to demonstrate a functional exercise to help you loosen up your stiff lower back. Now this exercise is assuming that you don't have any serious pathology with your lower back, particularly a herniated disc. So we're going to go through this together. If you have any concerns about it, make sure that you talk to a healthcare provider first. But this is meant to serve as an exercise for someone that's just been sitting for a long time. Maybe you've been in the car, maybe you've been working or things like that. This is a quick functional exercise you can use to help you loosen up the lower part of your spine, the lumbar vertebrae, and also get a little bit more mobility in your upper spine as well. This is another episode of Working Body Wednesdays, where we work on posture, functional movement, and techniques you can use to harden your body so it's better able to handle the stressors of daily life. Before I show you the exercise here with Danielle, there's one important thing that I want you to think about with your spine. Each section of your spine has different potentials for movement. For instance, the upper back has a lot of ability to rotate and side bend versus extension and flexion, whereas the low back has a lot of potential for movement in the plane of flexion and extension. That doesn't mean that you should be doing this all the time, but you have potential to move in that plane. So this exercise would be appropriate, of course, as long as you don't have a herniated disc, severe stenosis, or severe degeneration of your spine. For this particular exercise, you're going to need a large exercise ball. This one is about 65 centimeters in diameter. You can use a 55 depending on your body size. It should work just fine. But notice that I have Danielle sitting up against the wall here. And the purpose of the wall is to act as something that gives her some proprioception, some feedback of where she is in space. And then I also have her hips above her knees slightly, so there's a downward angle at her pelvis, so she'll be able to hinge at her hips a little bit better. Now, this is called spinal articulation, and the purpose of this is to get each vertebrae to move a little better so you don't have as much stress on a single area of your spine. And by doing that, you redistribute the forces, so you get the upper spine to move better, you get the lower spine to move better, so if something hits you or you move funny, all of it's not going to an area of your spine that moves too much. So Danielle's going to start tall through the crown of the head, and she's going to try and be relatively relaxed as she does this. I use the image of diving over a fence, or like you're a slinky trying to fold over yourself. The ball is here for her hands to rest in front of her, and then she's going to start by just gently sinking the sternum and peeling her upper back away from the wall. And while she's doing that, she's trying not to just let her whole back come forward. She's just reaching over my hand. Her hands are coming out too, so the ball is starting to roll out. And now she's drawing in her lower abdominals so her low back stays against the wall. Yes, there. So her low back's a little stiff right there, and she's trying to get each one of those little vertebrae to move. Now when she gets right about there, we're at the top of her pelvis, so we're no longer in her low back. And then she's going to start to dive the pelvis forward. Her hips are going to spin open so she can hinge at her hips. She's reaching out. She's keeping a nice long line through her spine. Good. And then she's going to reverse the motion by first drawing the pelvis back, tipping the pelvis back towards the wall. She's going to draw in her lower abdominals. Her head's going to be the last thing to come up. She first has to get a vertical pelvis, and then she can use her abdominals to peel back up the wall. She opens up her shoulders. She starts to lift the chest, spreads the collarbones, and she's tall through the crown of the head. You would repeat that exercise probably 5 or 6 times. You could do that without something in front of you, but it allows you to relax your hands and arms so the weight is along that line there. This has been another episode of Working Body Wednesdays. If you enjoyed this video, subscribe and hit the little bell so you never miss another video. Thanks a lot for stopping by, guys, and I look forward to seeing you in the next episode.